Let's talk about appendicitis. What's appendicitis like?
Well, appendicitis is inflammation of the appendix. That's a tiny little knuckle that sits off the end of the large intestine. It's very common. About 1 in 6 people will develop appendicitis in their lifetime. For most people, it's a surgical disease. That means they require an operation to treat it.
And what are the symptoms like, and where is the appendix located, and why? Tell me about the symptoms.
Well, people generally don't feel well. They kind of have just a dull bellyache. It then moves down to the right side of their abdomen, kind of right above their hip. And then it becomes progressively worse. They oftentimes will develop fever and other GI problems like diarrhea or nausea or vomiting.
So it's the right lower quadrant. When you examine the patient, what are you looking for? What's it like? What's it feel like when it's down there?
Well, I use the one finger test. If you press there and it hurts severely, so much so that the patient jumps off the bed, we call that rebound tenderness, then that's my diagnosis for appendicitis.
Is there a rebound pain? If you push over on the other side and let up and the pain goes to the right?
That's another one of the tests we do. Sometimes we'll move people's legs. Sometimes we'll even just bump the bed gently.
Wow.
Because we don't want to hurt the patient too severely. But that helps us make the diagnosis.